variant is a cause for concern, not a cause for panic.
Our other big story tonight, keeping a close eye on a new COVID strain. World health officials say the Omicron variant poses a very high global risk. Here's 3 things we know about it right now. It was first identified in South Africa and then declared a variant of concern by the World Health Organization on Friday. At least a dozen countries have reported cases. And late this afternoon, the CDC urged all adults to get a booster shot as this variant spreads. So what is Connecticut doing about the Omicron variant? Channel 3 Eyewitness News reporter Mike Savino had the chance to talk to the governor today. And Mike, right now, no signs of this new variant in Connecticut just yet, right?
You're correct, Aaron. We have not seen Omicron in any of the screenings, but this is a very new variant and we're still learning a lot about it. So is the governor bringing back any COVID restrictions as a precaution?
So if you have not yet got the booster, get the booster. It can make an enormous difference.
Governor Ned Lamont today urging people to stay up on vaccinations as doctors watch a new COVID strain. The Omicron strain is relatively new, but it's already seen as a strain of concern. But are vaccines effective against this new strain?
I don't believe that to be the case at this point, but like I said, it's pretty early.
Doctors say it could take a couple of weeks before we know more about Omicron, but for now, they agree with Lamont that getting vaccine and booster shots is the best approach. Could we see mask mandates and travel restrictions come back?
I don't think, not yet. We have such an overwhelming majority of our people vaccinated.
For now, Lamont doesn't see the need to expand on the Biden administration's latest travel restrictions. Meanwhile, doctors say masking indoors is still a good idea when you're unsure of other people's vaccine status. Omicron may not be in Connecticut, but COVID cases are still going up. Do doctors think it's time to worry?
We have more tools in our toolbox to manage the patients. We are better prepared as a system, as a hospital.
Doctors say their biggest concern right now is COVID fatigue and the possibility that people will stop following public health guidance. But what about fatigue in the healthcare field?
We're not handling it well. We do have a lot of burnout.
Nurses say they're already feeling overworked due to staffing shortages, and with a recent rise in hospitalizations and a new strain of concern, some are worried about what this winter will bring.
At some point, we're going to break. We're going to break, and that's what's happening. People are leaving in groves.
Now, the vaccine still remains widely available, and 2 new pills to treat COVID are expected soon. So that nurse you just heard from, she says those things do give her hope. Now, coming up on Eyewitness News at 6, I'll show you how the state tracks cases to know which variants are here. Live from the Answer Desk, Mike Savino, Channel 3 Eyewitness News.
All right, Mike.